your emergency?
It's my mum. She's having some trouble with her breathing. It's like she's taking some sort of reaction.
She ever had any kind of reaction like this before?
No, never. I've never seen her like this.
Yeah, okay. So can you give me your address and postcode?
Yeah, my address is Negwagon Road, Dermacash. Postcode is BT666LF.
Yeah, okay. So I'm going to dispatch an ambulance unit to your location right now. What I need you to do is ensure that your front door is open so our paramedics can get in without there being any issues.
Yeah, okay.
How are we today?
Yeah, I'm okay. I just called you out because I'm a wee bit concerned about my mum.
That's no problem at all. My colleague's just going to check on your mum here now. Is there any medical history we should know about?
Well, she's been very tired for a few days now and has had a bad chesty cough. She says she contacted the GP and was prescribed an antibiotic for a chest infection. I went and got the prescription for her this morning and gave it to her while she was having her breakfast, but since then it seems to have just gotten worse.
When you arrive at the scene of an incident, you can already get an idea of the situation that's going on, which is why it's important to look for any witnesses or family members on hand who can also give you a wee bit more about what's happened and actually a wee bit more about their medical history.
Do you know if your mum has any medical conditions or allergies?
I know she's had asthma in the past, but other than that, I can't think of any health problems she's had, especially with her chest.
Does she use anything like an inhaler or even daily medication?
I haven't seen her using anything, so I don't think so. I'm normally away at uni, so I'm not here during the week, just at weekends.
Okay, I'm going to need to put a cannula in your arm.
What about a heart condition or diabetes? Do you know if she's ever had these in the past?
No, never. I've never seen her like this.
It can be surprising when we turn up on location if there isn't another adult or a partner there, how little some of the kids and young ones know about their parents' medical history. It does make things a little more difficult, but we always do our best to reassure them to let them know we have everything under control.
Okay, Adele, right? We think you're having a reaction to your antibiotic, so you need to go to the hospital for further treatment. I understand this is a really scary experience, but you are in good hands.
Allergic reactions have the potential to become very serious very quickly. We carry the drugs with us to the scene of the accident and try to administrate them as quickly and efficiently as possible because the reaction can in fact be fatal to the patient.
Adele, I'm going to have to put a strap around your arm, okay, so we can put a wee needle in your hand. I'm just going to check your breathing again, okay?
Giving adrenaline is the first line of protocol that we follow when dealing with an allergic reaction. Many people who suffer severe allergic reactions and anaphylaxis will carry an EpiPen with them, which actually contains adrenaline. We will then administer a nebulizer, which will allow the patient's airways to open properly and allow them to breathe.
We will also give further treatment, which will help reduce inflammation and swelling, which in turn will help reduce the size of the tongue and open up the airways, which was the thing that made breathing so difficult in the first place for the patient.
Just focus on your breathing, okay? You're doing great. Relax, you're doing really well, okay? You're going to be alright.
Your oxygen levels are returning to normal, don't worry. You're getting plenty of air.
Because of your tongue closing off your airways, that lack of oxygen really does help with the fear beginning to set in.
But at this point, the most effective way of administering treatment is by injecting drugs straight into the patient's system.
What I need you to do is keep your arm nice and still for me, okay? Adele, we're going to give you some adrenaline, okay? And what I'm going to do is inject this wee needle into your hand.
It's alright, don't worry.
You're shaking because your body's reacting towards the adrenaline. With each tremor and palpitations happening right now is a normal reaction. It's part of the process to counteract the swelling.
I knew that her body was going into overdrive, and I knew that if I didn't treat her immediately, we would have had a fatality on our hands.
Once we've dealt with the emergency, it's important to make the patient feel comfortable for the journey to the hospital. After that, we make sure to keep a good record of any and all medication that we've given her, just to help our colleagues out in A&E.
What we're going to do now, Adele, is try and increase your comfort level as the swelling goes down.
A&E, it's Dean here on West 433. I have a medical alert for you of a woman in her early 50s, anaphylaxis to antibiotics.